Let's turn now to news from India, the epicentre of COVID-19 currently, and it's a desperate picture from that nation of over 1.3 billion people. It seems despite being a major manufacturer of COVID-19 vaccines, the country has not been able to inoculate enough people to ward off this massive tsunami of infections. Leading doctors are simply saying that the healthcare system has collapsed. I'm joined now from New Delhi by correspondent Pavni Mittal. Pavni, thank you so much for joining us. So, just what is the latest news on the hospitals and the people who are desperate for oxygen and treatment?
Well, unfortunately, since the last time I spoke with you, there hasn't really been much improvement. You know, what we've seen is that people are coming together to help out on Twitter, on social media. We have seen aid arrive from different parts of the world. You know, Europe is sending aid, the US, Thailand just sent some oxygen. We've seen a lot of Indian Americans in the US who've been raising money and have promised to pump in money so that people can get hospital beds and oxygen. But that still remains a big hot property over here. In fact, oxygen, like, you know, I am in New Delhi and Delhi doesn't have an oxygen plant. So when we're getting oxygen from different states, those tankers are being accompanied by army cars so that, you know, authorities at the borders cannot stop those tankers and they can make it to the hospital. So unfortunately, we still have a lot of people dying, not just because of COVID, but because they cannot get to the hospital and they cannot get a bed with oxygen.
Horrific. We've heard over the last week at least 300,000 new infections a day. Last time we chatted, you made the point that it's probably much higher because there are not as many tests available as one would like. We've also seen 2,000 deaths a day. Have those daily figures increased, or are they starting to stabilize?
Well, they're sort of plateauing. You know, Mumbai, which was the epicenter a couple of weeks ago, that's seen a massive drop. Delhi also has been sort of coming closer to the 20,000 figure. You know, it was earlier above 25. So I think people are seeing that the lockdown is working. But what we're seeing, and that's really scary, is that, look, Delhi and Mumbai are still big cities and they have the best medical facilities. What we're seeing is that cases are rising in states that do not have the kind of facilities we have over here, that have more tier 2 and tier 3 towns, rural areas, and that's really scary in terms of the numbers. And also, let me also remind you that the death count is definitely underreported, and that's because if people are dying at home and they do not have a certification from hospitals saying this is a COVID death, the crematoriums are not recording them as COVID deaths. So a lot of news reports are now suggesting that the numbers are way higher if you take into account people who've died at home and people who don't have a COVID certificate.
Let's talk about vaccination, because India, as we know, manufactures vaccines. It's one of the things that the country is known for. So I'm wondering why the vaccine rollout in India is not having an impact. Is it because the vaccines are not keeping up with the variants, or is it because the vaccines are being shipped elsewhere?
Well, I think it's a bit of everything. You know, if you remember, a few months ago, the Prime Minister said, you know, India is going to be the pharmacy of the world, and a lot of the vaccines were shipped out. And a lot of developing nations, especially some in Africa, were actually looking to India to supply vaccines. And what happened was that we ran short of vaccines here. Now, from this Saturday on, people above 18 will be eligible to get vaccinated. And while that sounds like a great thing, we don't have enough vaccines. Even today, you have centers saying we've run short of supply. Now, what has happened is that the U.S. has, is sending raw material that had been blocked for exports to help the Serum Institute ramp up vaccinations, and we're hoping that would really help out. We're also getting Sputnik 5 from Russia, which is going to be an additional vaccine that will be given out. The government has said it will look into expediting approvals for other vaccines from around the world. But, you know, this is a country of 1.3 billion people. Yeah. This is not going to happen very soon. And also, like I said, you know, India feels like it has to vaccinate many other parts of the world. So that's also something that, will play a big role.
Yeah, I have to speak to you about cricket, because in the midst of all this, the India Premier League continues. Now, we have seen at least one major player pulling out, saying that he feels he needs to support his family during this time of COVID-19. There are no spectators, but I'm wondering if there's a lot of public anger that in the midst of this awful crisis, there's still time to play cricket.
There is, and it's become controversial. And some people are saying, well, we need the entertainment because we're home. Some people are saying it really doesn't affect, the cases. But I think what's really happened with IPL is it's just been bad PR. They've not been able to really own the narrative. This is a huge platform. This could be a platform to, maybe, raise more awareness and things like that. But I think that the optics of it haven't really gone down well with large parts of society. There have been one Indian player and there have been some Australian players that have pulled out because there is fear that they may not be able to actually get back home in time because, as you know, a lot of countries have stopped flights. So that's been something that's been controversial. And of course, one player has, donated $50,000 to help with hospital beds and oxygen. And I think a question a lot of people are asking is, where are the Indian icons? Where are the Indian stars? Why are they not doing more to raise awareness and to help out in such a dire situation?